now from Humana. We have two folks with us this morning. We're going to sit down and we're going to talk with, I have to find their names here, Darren Davis and Mrs. Mary Foley. Is that who we have to with us this morning?
Yes, sir.
Yeah.
All
Good
right,
morning.
welcome. Thank you guys so much. We were just talking about the sign up period and Chuck, all of us, we all have different needs and we all have different things. It's not a one size fit all. And this is really unique when it comes to veterans. Darren, I understand this year's enroll period. It's underway. It's confusing. So can you tell us a little about Medicare and who's even eligible for it from the veteran side of you?
Sure thing. Yeah. So right now we're in, like you said, we're in the middle of that election period. Medicare is a government managed healthcare program for individuals who are 65 and over or who may be on disability. And then within that space, they've got a couple of different options. They've got original Medicare, and then we also have plans or companies like Humana, who are private companies that offer Medicare Advantage plans that offer maybe some potential additional benefits, maybe offer them some ways to cover some gaps within those plans. So a couple of different options out there for those folks.
And this has already opened up. You're already doing enrollment, is that correct?
Yeah. So the enrollment season or the enrollment period for Medicare is October 15th through December 7th every year. That's when those folks can make those changes.
We're talking about the changes and everything. It would seem to me as though, especially where the vets are concerned, it's not an automatic thing for them. And for some strange, I don't even know why I would think this, you would think that they would automatically be taken care of overall, even with the supplements, et cetera, et cetera. But it doesn't necessarily work like that. There's the whole process to go through, right?
Yeah, there is a process for sure as a VA patient myself, but the Department of Veterans Affairs actually does recommend that our veterans have both, that they have their VA benefits that they qualify for, but also enroll into Medicare as well. So there's going to be different options outside of the VA system that veteran may want to take advantage of. There's going to be different plans within the Medicare landscape that offer different copays, deductibles, max out of pockets, just lots of different options for them. So again, we encourage them to reach out to a licensed sales agent, maybe go to Medicare.gov, look at all the different plans in their area and see what's available to them.
Mary is with us. She's the Assistant Vice President, Life and Health with USAA. Mary, I understand that both USAA and Humana have worked together for many years. Can you share with us what brought these two things to come together to work together on this issue?
Yes, absolutely. Yes, we've actually been partnered since the early 2000s. And, really, it's both companies just have a shared commitment to our military community. And, together we combined the health expertise of Humana, just as Darren was talking about, and really the veteran experience and expertise from USAA. And we're especially excited this year because all of Humana's veteran-focused Medicare Advantage plans are now going to be co-labeled as Humana USAA Honor plans, and they'll be available to more beneficiaries and more locations. And these plans were all designed, you guys were talking about the unique needs of veterans. They were all designed with those unique needs in mind, but really they're available to everyone who's eligible for Medicare, and that even includes veteran spouses.
So do you find that, like with one plan, say the Medicare, they may be able to fill in some of the gaps that maybe a VA benefit package doesn't? Is it that kind of thing where they're what's the word I'm looking for? They help take care of them together. When one doesn't work, there's this over here to go to.
I would say what I do love about these plans is they do allow flexibility for veterans. So it allows them to keep those VA benefits, which they rightly earned serving our country, but it overlays more flexibility. And, when Humana and USAA were creating these plans, they did a lot of research with veterans, and veterans told us that they would use this possibly as backup coverage or maybe for a second opinion. or even, you know, if a VA facility is far from home or they can't be seen in a timely manner. So it does add a measure of flexibility.
So,
Mary, we talk a lot about behavioral health here on this show. Very important topic, especially now, uh, especially for veterans. Can you share a little bit about some of the available resources when it comes to behavioral mental health?
Yes, absolutely. It's a great question. And, you know, yes, I mean, and mental health is important really for all of us. And yes, especially veterans. We know that the veteran suicide rate is 57% higher than the national average. So it's critical. And, you know, getting help for behavioral health type of conditions really impacts your overall health, even your physical health. And so USAA, with the support from Humana Foundation and others, has launched the Face the Fight Coalition, really in an effort to break the stigma of asking for help and even to raise the awareness of veteran suicide. And you can go to a website, wefacethefight.org, and there's a lot of resources available there for those who may be struggling. But really, in all honesty, you know, you can support a veteran just by showing that you care and really fostering, you know, open dialogue and conversations around support and hope.
Darren, where can viewers and listeners go to get more information on both Humana and Mary, of course, with USAA?
Yeah, I think Medicare.gov is probably a great place to start with that. They can go and review all their different plans and options that they have available to them, really across their area that they live in. And then if they want specific information on Humana's plans, they can go to humana.com.
All right. Well, Mary, Darren, thank you so much for your time. As a veteran myself, I appreciate the extra effort and the extra care put into taking care of the men and women who have protected our freedoms. Thank you so much for the info.
Thank you.
All
Thank
right.
you.